Welcome to the Getting Started with Duet program. This brief presentation will introduce you to the empirical fitting process for Duet HD and Duet Multifocal. Hi, I'm Dr. Jim Kirchner. I'm Senior Vice President of Clinical and Professional Services at Synergize. Prior to joining Synergize, I founded and spent the majority of my career in a multi-doctor, multi-location practice in Lincoln, Nebraska. I saw firsthand how the Duet family of lenses gave my patients the best possible vision while helping to differentiate my practice and build a recurring revenue stream. I'm excited to share this information with you today. So let's get started. Before we walk through the fitting process, let's talk briefly about how you and your staff might identify patients in your practice that would benefit from Duet lenses. Let's start with Duet HD. Many of our successful fitters assess both their patients' visual requirements and their satisfaction with their current modality to uncover a need for Duet. Those patients who need precise visual acuity for their work or hobbies, patients who do a lot of night driving, and those astigmats who frequently shift their gaze will all be thrilled with the exceptional vision delivered by Duet HD. Current contact lens wearers who notice blurry vision at the end of the day, when they shift their gaze or lie down, or when they're driving at night are all excellent candidates for Duet HD. Also look for those patients who rate their vision as less than an 8 on a scale of 1 to 10. They'll be pleased to know there's an option for better vision. And of course, those patients who come in asking you what's new, they'll be excited to hear about the latest contact lens technology from you rather than hearing about it from somewhere else. Let's now shift to Duet Multifocal. Reach for this lens for those patients who need steady, clear near vision for their work or hobbies, patients who do a lot of reading or computer work, and people whose job or hobbies require a combination of near, intermediate, and distance vision. Another way to find patients for Duet Multifocal is to look for people who are dissatisfied with their current correction. Think of your patients in glasses who would like to wear contact lenses, but they've been told they can't because of their astigmatism. Patients wearing readers over their contacts are also great candidates for Duet Multifocal because of the exceptional near vision this lens delivers. And current multifocal wearers who would like better vision at all distances will be thrilled with Duet Multifocal. The key is to ask the questions that give you a true picture of the patient's vision needs. Whether they're astigmatic, presbyopic, or both, you can improve their vision and make them happier with the Duet family of lenses. Let's now talk about the fitting philosophy and methodology for the Duet family of lenses. Fitting Duet lenses is as easy as fitting a soft lens. In fact, once the RGP base curve is determined, the rest of the fitting process is identical to fitting a soft lens. The lens fit is determined by the soft skirt, which is assessed based on comfort and movement. Unlike past products from Synergize, there's no need to use fluorescein during the initial lens fit. As with any other contact lens, you may find the need for fluorescein at the follow-up visit, but it is not necessary to assess the initial lens fit. This streamlined fitting approach results in positive outcomes, happy patients, and long-term success rates. To order Duet lenses empirically, simply call our consultation line with your patient's Ks and Rx. We'll design a lens for your patient with an RGP base curve that's closely aligned but less than a diopter and a half steeper than the flattest K, with the goal being to produce and maintain a minimal plus-tier lens. You can see from the chart on the right-hand side of the screen that there are 6 Duet base curves available, ranging from 8.1 millimeters to 7.1 millimeters. We will send you lenses with flat skirt curves in order to enhance tear exchange and the movement of the lens. If you're fitting a Duet Multifocal patient, you will receive 1 small zone and 1 large zone. The mixed zone strategy allows the binocular visual system to fully utilize both zone profiles for the maximum optical effect. At this point, eye dominance determination is an optional step. Clinically, eye dominance does not drive the choice of which eye has the small zone. We will design lenses with the small zone on the right eye. Unless you tell us that the left eye is dominant, then we'll design the lens with the small zone for that eye. Let's now take a moment to discuss a few tips for handling Duet lenses. Duet lenses are packaged in vials, and the easiest way to remove them from the vial is to shake the lens out over sink into the palm of your hand. The lenses may then be stored in a flat pack for easy access. The simplest way to get the lenses on the patient's eye is to use the lens inserter that will be included with your first Empirical order. Using this tool in your office makes insertion quick and easy for you and your staff. You'll want to teach your patients to insert the lenses without the inserter. Fill the bowl of the lens with solution prior to insertion and ask the patient to hold his or her lower lid while you hold the upper lid and insert the lens. To remove the Duet lenses, use dry fingers to pinch the bottom of the skirt, much like you'd remove a piece of lint from your clothing. It's important that you don't try to grasp the rigid center. Apply a small amount of pressure until the skirt puckers slightly. The lens can now be gently lifted away from the eye. Again, remember that dry fingers are key for easy lens removal. It's a good idea to practice insertion removal prior to having the patient in your chair. Inserting and removing Duet lenses is slightly different than with other lenses, but it's easy to master once you've practiced it a couple of times. Let's now discuss how to assess the lens fit. Begin by filling the bowl of the lens complete with solution, inserting the lens, and then allowing the lens to settle on the patient's eye for at least 10 minutes or up to 30 minutes. You can move the patient out of the exam lane and allow them to sit for a length of time that works best with your practice workflow. When the lens has had a chance to settle, you can assess the fit. Remember that we're using movement and comfort to determine the appropriate lens fit. When you look at the lens in the slit lamp, you want to see about 1 millimeter of movement on straight ahead and upward gaze after a full blink. You also want to make sure that the lens is centering properly and that there's no wrinkling at the skirt edge. If you see wrinkling, you'll know that you need a steeper skirt. You also want to assess patient comfort. Now keep in mind that at this stage, there might be a little more awareness of the lens, which is completely acceptable because comfort will improve as the patient adapts to the lenses. It's important to differentiate between discomfort and mild awareness, because a truly uncomfortable sensation suggests that a tighter skirt might be needed. Once you've assessed the lens fit, you're ready to do the check of the patient's vision at distance and near. Using the over-plus refractive method to protect against inadvertent over-minusing, perform a distance over-refraction. One of the biggest errors I see my colleagues make when fitting Duet lenses is over-minusing the prescription, because it's so easy to do when refracting over the aspheric RGP button, especially if you're fitting the multifocal. Once you've reached the endpoint of your over-refraction, you should have a final lens power that's up to a diopter and a half more minus than the spherical portion of the spectacle refraction. This is due to the plus tier lens that you've created under the RGP base curve. Let's look at an example. If you have a patient with a spectacle refraction of -2, -1.5 axis 90, you would expect the final Duet lens power to be between -2.5 and -3.5. You'll notice that I've highlighted and crossed off the astigmatic portion of the refraction. Remember, the RGP button will cover up and eliminate corneal astigmatism, so you only have to be concerned with the spherical portion of the refraction. If the final lens power is more than a diopter and a half more minus than the spherical power of the spectacle refraction, you need to order a flatter base curve. Also remember to be aware of possible residual astigmatism, which can cause blur. Duet lenses are not designed to correct lenticular astigmatism, so if you're seeing residual astigmatism, the patient may not be the ideal candidate for the lens. Let's now talk briefly about the dispensing visit. It's important to set appropriate patient expectations, especially when you're fitting multifocal patients. Let your patients know that they may experience an adaptation to the feel of the lens. Lens awareness may last up to a week, with awareness decreasing over time. If you have a Duet multifocal patient, they also need to adapt to the simultaneous optics that the lens delivers. Occasionally, printed words may appear to come off the page, or your patients may notice shadows around objects at near. This typically goes away within the first week or two of wear as the visual system adapts to the optic design of the lens. You may want to recommend a tiered but aggressive increase in wear time for the first 7 days. And let your patients know that insertion removal takes a little practice, but it's a skill that they will quickly master. Before sending the patient home with their lenses, have a staff member thoroughly train them on insertion removal and lens care. We have videos available for your patients and your staff at duetcontacts.com. Be sure to use these resources to set your patient up for success. And when you're recommending a lens care system, use solutions that are approved for use with silicone hydrogel lenses. Our testing has shown that the best solutions to use with Duet lenses are ClearCare Peroxide System, BioTrue, and Aquify multipurpose solutions. This concludes the Empirical Fitting Process module. We appreciate your time and attention. You may now wish to move on to the Tips for Success module. Thanks again for your time and interest in fitting Duet lenses.